the sacrotuberous ligaments and the sacrospinous ligaments. The sacrotuberous ligament goes from the sacrum to the ischial tuberosity, whereas the sacrospinous ligament goes from the sacrum to the ischial spine. Now, to talk about those bony landmarks individually before we start to bring it together with the ligamentous structures on that pelvic model, if we look here, we can talk a little bit about the bony anatomy of the hemipelvis. The hemipelvis is made up of three bones: the ilium, the ischium, and the pubic bones. And all three of these come together to fuse at the acetabulum, which the femoral head of the femur articulates with, forming a ball and socket type diarthrodial synovial joint at the hip. Aside from that, although all three bones that contribute to the hemipelvis fuse at the acetabulum, two of them come together to form this bony landmark known as the greater sciatic notch. It's a notch, it's not a foramen, because there is nothing completing it to form a whole foramen. So for now, this is the greater sciatic notch, and this is the lesser sciatic notch. The demarcated change occurs thanks to the ischial spine. So if this is the ischial spine, and the namesake tells us this is part of the ischium, and we can obviously see that this is part of the ilium. Therefore, the greater sciatic notch is made up of the ilium and the ischium, but the lesser sciatic notch, which begins at the ischial spine, is made up of the ischium only. Now that we have talked about some of these bony landmarks, whenever we come back to that pelvic model, we can see that the sacrotuberous ligament helps create the greater, or helps turn the greater and lesser sciatic notches into one big sciatic foramen, period. But the sacrospinous ligament comes in and divides that one big united sciatic foramen into a greater and lesser portion. And what's further important about the greater sciatic foramen is that this piriformis muscle comes in to divide the greater sciatic foramen into a supra and infra piriformis space.